Hey, beautiful people, welcome or welcome back to Well with Mika, where we talk real wellness for your real life. I'm Mika, your cultural wellness ally, and today we are diving into something that affects half the population, and it is just now getting the attention it deserves and is being talked about openly, and that is our hormones and how they shift through the every decade of our life. Because here's what you need to know. Your hormones, they don't just change at menopause. They evolve through your entire adult life. And right now, even the medical world is changing how it talks about them. So recently, as in November of this year, 2025, this month, the FDA removed one of the biggest warning labels from menopause hormone therapy, and that is the black box warning. Now, this is huge because it directly affects how we think about things like hot flashes, sleep, mood shifts, bone health, and heart health. Now, if let's address this because most of us grew up watching our mothers and grandmothers and aunties suffer through menopause in silence, or maybe they just called it the change, but never really talking about what it meant or what help was available. You just knew they get hot flashes, they going through the change, and that's it. And that generational silence, it doesn't have to be your story, our story in this day and age. Not They weren't doing that because they wanted to withhold, the symptoms or what's happening. They just didn't have the information. They didn't have access. Women's health was not and still has needs to make some really large strides, but they just didn't have the information about it. They just knew that things were changing. They knew that women of their age went through it, and that's just what it is. So today I want to break it down in a way that feels practical, empowering, and real so you can really understand what's happening in your body or what will happen in your body and what this FDA change actually means and what your options are for moving forward. Now, I have to state this because it's important. This is the medical disclaimer. I am not your doctor, your healthcare provider. I am not your health coach. As always, this information is educational, not medical advice. So please discuss, talk, converse with your healthcare provider about your specific situation. All right, let's get into it. In November, a few weeks ago, probably what, last week at this point? I can't keep track of time, okay? The FDA removed the black box warning, and that is the strongest caution label from many menopause hormone therapy medications. So, why did they do this? Because newer research shows the original warning from the early 2000s, it was too broad and didn't tell the full story. Okay, back then there was a huge study, if you're not familiar with it, called the Women's Health Initiative. And in that study, it was reported that there was an increased risk of breast cancer, stroke, and heart disease for women taking certain hormone therapies. That study completely reshaped how doctors treated menopause. And honestly, it scared a lot of women away from even seeking relief and medicine to help with their symptoms, right? But now, decades later, scientists realize number one, not all hormone therapy is the same. Age matters, dose matters, the method, whether it's pill versus patch versus gel, those things matter, and the risks are not the same for everyone. Some of the therapies used today, they weren't even available during that original study, and with, the science grew and the label did not. So until now. So the FDA is finally updating the messaging to reflect reality instead of fear. Now, this is huge because, I mean, we are all, if we're paying attention, and some of us, I'm not naming any names, including myself, might check out from all of the news because everything kind of seems a little chaotic and doom and gloom. And we are not political here. We are just talking about wellness, right? So this is, to me, this is a silver lining. This is like, oh, okay, this is a positive thing coming out in the news where the black box label is now being removed. Okay, so I am extremely happy about this change. And the change, it matters because the conversation is now more personalized and more hopeful than what many of us were told. And I also want to be clear about this. This doesn't mean that hormone therapy is suddenly perfect or risk free. It means we're finally having a more honest, nuanced conversation instead of the fear based blanket warnings. All right, so let's just be clear about that. Now, let's also zoom out for a moment. Many women think menopause is just one event, but really, your hormones, they evolve across your entire adult life, as I said in the beginning. So, in your 20s and 30s, hormones, they fluctuate with stress, pregnancy, postpartum, birth control, sleep patterns, work demands, and parenting. Estrogen is generally high and protective, but it's protecting your heart, your bones, your brain. But life is already impacting your hormonal balance in ways that you might not even realize. Then in your 40s, we get into perimenopause, right? And it begins quietly for many women. Progesterone dips first. That's why you might notice, anxiety creeping up, heavier cycles, your sleep is changing, or that feeling like you're losing your mind, even though there hasn't been any real major changes in your life, but you're like, what is happening? It's not just stress, it's actually biology. And I see you, the woman who's been told that she's overreacting when her body is literally shifting. I feel you. I understand it. I am right in there in the trenches with you, okay? Then when we get into our 50s, good old menopause comes into the picture, right? And that's defined as the 12 months without a period. So your estrogen declines sharply. This is when the hot flashes, night sweats, vaginal dryness, joint stiffness, brain fog, and mood changes, those show up for many of us. So this isn't weakness, please know. It's a natural transition and it just deserves support. I also wanted to state that we might notice some of these changes. Like it might seem like menopause. This is why it's so important to have these conversations because prior to the last few years, just to get a little personal, in my early 30s, I started to have night sweats. No one could not have told me. I thought I was going through early menopause because perimenopause was not even a word that I'd ever heard of. It wasn't in the conversation. And so to know that, okay, this is part of perimenopausal symptoms, to know that this is a personal experience and that, there's nuance to this, but just to be able to have that conversation and know that, okay, I'm not crazy. Something is wrong, something is different. It might not be wrong, but things are changing, and so that we can actually get some relief. That's why this conversation is so important. So I just wanted to put that out there. All right, so we tackled the 40s, the 50s, and now let's get into the after menopause period, which is your 60s and beyond. The hormone picture, it starts to stabilize, but you have lower estrogen, and that can affect your bones, your heart health, metabolism, and memory for the rest of your life. So when we talk about hormone therapy, we're not talking just about vanity. No, this is not just vanity metrics. We're talking about quality of life, and in some cases, real protection for long term health. So, what does hormone therapy actually do? Hormone therapy works by replacing some of the estrogen and sometimes progesterone that your body naturally produces less of during menopause. So it can relieve hot flashes and night sweats, improve sleep quality, support your vaginal and urinary health, reduce joint discomfort, protect bone density, improve mood and cognitive function in some women. And the nuance the FDA is finally acknowledging, the benefit risk balance looks very different for a 51-year-old newly menopausal woman than for a 67-year-old starting hormones for the first time. Those are two very different people in two different situations with two different biological profiles, physiological profiles. And vaginal estrogen, the kind used for dryness or urinary symptoms, has extremely low systemic absorption. So its risk profile is almost entirely different from oral pills. So, in other words, one size does not fit all in a few categories. And that old warning label, it just didn't reflect that. So, that's how we've come to where we are today. So, what does this mean for you? Especially as a black woman, we have to talk about this culturally for a moment because it matters, right? Black women often enter menopause earlier than other groups. We experience more severe hot flashes, wait longer to seek help or get dismissed when we do, have higher rates of fibroids, which can also complicate hormone decisions, face more medical bias and are less likely to be offered treatment options. And we carry more chronic stress, that allostatic load, which it just affects how our bodies respond to hormonal changes. And we have to keep it real. Many of us grew up in households and cultures where hormone health, it just wasn't explained because it wasn't known or understood. We just dealt with the symptoms silently, privately, with some humor. You just laugh it off, and we push through. So this FDA shift, it matters. It puts the evidence back on the table, gives women more options, and it encourages better conversations with our doctors. So you deserve care that reflects your symptoms, your history, your needs, your risks, your preferences. Not blanket fear, not silence, not generational, just deal with it, okay? We're really getting to the meat of this and getting into the actionable steps so that when we walk into our doctor's office with our symptoms, we can have a real conversation, a real collaboration. So if you're curious about hormone therapy or struggling with the symptoms, here's how you could possibly move forward. Number one is know your stage. Ask yourself, based on knowing, your symptoms, your age, am I in perimenopause, menopause, postmenopause? Your stage is going to shape your options and what treatments make the most sense. Know your symptoms. Keep track of your symptoms. What's actually bothering you? Is it your sleep, your mood, joint pain, hot flashes, brain fog, vaginal dryness? Treatment should match your symptoms, not someone else's plan or a one size fits all approach that you might have heard online. Really tailor it to what you're actually going through, because not all women will have the same symptoms. Know your risk profile. You talk to your doctor. Know your family history. Is there a history of breast cancer or blood clots? Do you still have your uterus? Because this affects whether you need progesterone. What are your blood clot risk factors? Is a patch safer for me than a pill? What's my personal risk benefit ratio based on my age and health history? These are questions and conversations that you should have with your doctor. Also, don't discount non hormonal support too. Like I said, no one solution fixes everything. We all know lifestyle matters. It still matters at every stage. So consider consistent movement and strength training. These should be part of the foundation, just mind you. Fiber forward eating that supports your gut and your hormones. So make sure you're eating fiber rich foods. You want to support your gut health. Quality sleep habits. Now, if this is one of the symptoms that you're experiencing, definitely bring that to your doctor, but do what you can in the meantime. Make sure you're eating within a right window, not too close to bedtime. Just do what you need to do to get your sleep hygiene in check. Stress reduction practices, community and social connections, sunlight exposure, joyful movement, not just exercise. Do things that make you feel good. Move in ways that make you feel good. These practices, they support your hormones whether or not you choose therapy. And of course, advocate for yourself. This is critical, okay? I always suggest this. You have to ask your doctor, what are my options for managing these symptoms? How does my age affect the risk benefit balance? What dose is safest for me? Have the conversation. What a patch, cream, all the different options. What makes sense for my situation? What updated research are you using to guide this recommendation? And if they dismiss your concerns or rush you out, find a second opinion. Get a second opinion. This is your body. You deserve informed care, not outdated fear tactics, not someone that's going to be dismissive. Don't be afraid to have those conversations. And if you feel a bit timid, you feel uncomfortable having those conversations with your doctor, bring in someone that you think can advocate for you. If you feel very comfy with somebody else, and you want to have this companion with you at your appointment, bring that person in. Let your doctor, let them know, look, I have someone here that's my, I guess you could even call them your advocate, and just let them know that you're having that appointment together. All right. And based on what you want to happen with your body. So your hormones, they move with you throughout the decades. And now the medical world is finally moving too. So the old warnings, they didn't tell the full story, but this new research is giving you more freedom because you have more choices and more clarity. And what this means when I talk about real health, real wellness, that right for you, not what worked for someone else, is working for you, is energizing, supporting your quality of life, not just solely managing disease. Achievable, realistic options that you can actually access, lasting choices that work with your body long term. Not fear, not confusion, and not silence. You get to make the informed choices about your body at every age and every season. So, thank you so much for joining me today. Please share this episode with a sister, with a friend, with, your nieces, if they're of a certain age and they're, rolling into that stage of life, or anyone moving in through their hormonal shifts who wants or you feel they should have that clarity and community. Please share it, leave a comment, let me know what you're going through, how you plan on managing your hormonal health, how the news of this black box warning being removed, how that, impacted your choice of getting therapy or not. Please share it in the comments. And then until next time, take care of your body, your hormones, and your whole self. As always, happy health and peace.